Hello again. I'm still Ashley Jones, Developer Relations Engineer, and I'm going to be talking about CHT 5.1. As well, we'll have some demos and other folks talk about the different features in it. Next slide, please. So CHT 5.1 was released recently, and we're excited to announce that we have 26 contributors, which is the most contributors for any CHT release to date. This is especially good because a lot of community was participating in this, contributing to the different features and ensuring that the features meet the needs of the deployments that are using them. The 5 features that we're going to cover, there's a lot more, but these are the premier features, is previous month's targets. This allows a CHW to go into the targets and then easily toggle to see the prior month's targets. There was an issue with when the first of the month came around, they couldn't see their prior month's targets. So when reviewing those targets with the supervisors to see if how their accomplishments went, they had trouble because they disappeared. So now you can easily switch between them. As well, there's a navigation along the bottom with the different icons, and there was a need to have a little nudge about tasks that were overdue. So now in 5.1, there'll be a small red bubble with the number of tasks that are overdue on the task icon. And we actually have another thing about tasks, which we'll get to at the end. But there was a deployment that needed to take photos, and so they wanted to be able to attach the photos to contacts. And while we can support currently before 5.1 the ability to attach photos to existing workflows, there wasn't the ability to attach them to contacts. So with 5.1 you can now attach any files, but in this case the workflow is around photos, but we do support other types of binary attachments if you need. Android notifications was a feature that came out of Uganda, and this took a good long while to do. You do need to upgrade to the latest CHT Android version as well, which is 1.7, but CHT 5.1 supports this. It is on by default, but can be configured on a per role basis to disable them if you want to not have them enabled. And then finally, task filtering. This was an interface that if you do have a lot of tasks and you're really struggling to figure out which ones are most important to tend to, there's now a way to filter tasks both by which ones are due or not due, and which ones sort them by type, sorry. So this should enable CHWs to drill down to the tasks that they're looking for. All right, next slide, please. I think we're handing it over to Josh for a demo on previous month's targets.
Awesome. Yes. Thank you, Ashley. So many great features here. I'm going to show just very briefly. We'll start with the simple one here. Previous month's targets. As Ashley's kind of already described, the idea is as a user, when I go to the targets tab, I'm actually here looking at the targets for this month. And as you can see, in March, I have got very little accomplished. So lots of zeros. But what I actually want to see is maybe I want to go back and look at what I was able to do in February. And as of 5.1, we've got this nice filter icon up here. It kind of matches the same user experience on other parts of the app. And I can change my reporting period here and just select last month, apply that. And now you'll see my targets have updated in here to what I had last month. These targets, of course, are fixed. They're not going to change as we go forwards because it's from last month. And you can see here, it will call out in the subtitle the month that the target is from. And if I select the back button here, it just takes me back to the default targets tab. And I'm once again looking at the targets for this month. So shout out to the whole team of people. This was very much a community effort to get this out, and a big thank you to Lukman for kind of leading the design and the impetus on this as well. So it's super great to have this live and available. Back to you, Ashley.
Great, thanks, Josh. I wanted to ask Koshmika to come on and talk about some of the prioritization challenges they've been facing in Nepal. And Diana, if you could go ahead and share the slides.
Can you please confirm it's working?
Looks good.
Okay, thank you for giving me time. Hello and namaste everyone. I am Kusmika Hamal, Community Health Officer at Bardibas Municipality, and I oversee the 14 community health nurses. For the last 4 years, we have been serving longitudinal care at the household levels using the Community Health Toolkit. And this Community Health Toolkit is a valuable and useful platform for delivering health services to the community, and we are grateful to be a part of it. However, we are facing some challenges with tax prioritization and tax filter by area or toll. In each CHN is assigned to one ward, which is the smallest administrative unit. The CHN is responsible for providing health care services to household in that ward. In each ward, there are 2 to 9 female community health volunteers, depending on the population and size of the ward. When a person is registered in the system, they are registered under the FCSB area. When a CHN visits a specific FCSB area to provide services, it becomes difficult to identify which household or individuals need to be visited in that area. Similarly, we have many use cases and follow-up forms, which includes pregnancy surveillance, ANC visit and delivery confirmation, screening of children under 5, breast cancer screening follow-up, cervical cancer screening follow-up, hypertension follow-up, and diabetes screening follow-up. When CHN provide specific services to the community people, all types of tasks appear together in the task list, making it very long, and CHN have to scroll down through many tasks to find out the relevant cases for each area. Because of this, some people who need follow-up care may be missed. And in Bardibas municipality, Bardibas municipality is a semi-urban area, and some parts are difficult to reach when CHN go to provide services in a specific FCSB area. It will be helpful if the task list had a filter option, and this will help CHN easily identify the relevant cases in that area and provide services more efficiently, and reduce the chances of missing anyone who needs to care. And we are grateful that the CHT team for listening our concerns and addressing them thoughtfully and making the system easier to adopt and implement. And my concern is that's it. And thank you. If you have any questions, I will be happy to answer it.
Any questions for Koshmika before we go to a demo of the same feature that was just being discussed? All right, I see Willington has a question which I want to hold on to and just so that we can capture this moment. Diana, I think you have a demo for the task filters and the task bubble, which is pretty quick.
Yes. So I am going to show my tab right here. I don't have a video because it was too late to record, but you will bear with me. So I'm logged in as a CHW. Her name is Alanis58. She has 2,000 documents. And you can see in the bottom of the tab, so there are 2 features that I'm demonstrating here. First one is the overdue task bubble count. And you will see here a little number that says 33. I'm going to increase this so that people see it. It says 33. And this is the number of overdue tasks that this user has. So now I'm going to go to the task tab. We can we can count them, but trust me that this is this is the number that we're showing. It's not the number of total tasks. These are the number of overdue tasks. The other feature that I am going to demonstrate today is task filtering. So as you can see, the task list now has this little button here in the top right corner that reports, and this is the same button that you saw on targets just a moment ago. If we click this, we get a drawer that opens a filter section for the task tab. And there are 3 filters. There's a filter for due date, which has only 2 options now, whether we want to show overdue or tasks that are not overdue. The tasks that are overdue are the ones that are due today, the ones that show up in red. This is a translate. I know that some projects use different terminology for tasks that are due, overdue, due today, and so on. These are translatable values, so don't worry about this being confusing because these can be changed and they mean the same thing. So right now I'm going to select not overdue tasks, and I'm going to close the tab so we can see that my task list has been updated and I only see the not overdue tasks. So we see only the tasks that are due in the future. The button stays the same, so the number is the same. And now I'm going to change to overdue, and now our whole task list is only displays the tasks that are overdue. The other type of filter is the task type. So you will see here that I have only 2 task types, unfortunately. I have a delivery and I have a pregnancy home visit. So here in the type, I'm going to have these 2 task types. So I'm going to select, I'm going to deselect overdue, and I'm going to select pregnancy home visit. And now we can see that I only have pregnancy home visit tasks in my task list. And the last filter that I'm going to show you is the place filter. This has a little caveat. So the user that I'm seeing now, I'm logged in with now, is a CHW, but they are associated to 2 facilities. And this is the reason why I have the place filter. If the user is associated with a single facility and they do not have sub places to filter by, because you can see that I have 2 health centers here. I don't have any households. So if the user only sees 1 health center and multiple households, the place filter will not be available for them, mainly because the number of households can be very big, and it would mean that we would have to fit in 100 items in this list, which is unfeasible. So the place filter is only available for users that either are associated with multiple places, whose hierarchy is such that they have at least 1 other hierarchical place above the household that they can filter by. So right now I'm going to filter by Aurora's health center, and I'm going to untick pregnancy home visits, so we just see this. So you can see that now only tasks that are belonging to Aurora's health center are being displayed. And now we're going to just do all filters together. Aurora's health center, only pregnancy home visits that are not overdue. And also there is a button to clear all filters, which will end up showing the whole list of tasks. This is available immediately. It does not require any settings. It does not require any configuration. It will just you just have to install 5.1, and this will be present. That's it for this demo. Please tell me if please share questions in the chat, and back to you, Mr. Jones.
Wonderful. Thanks, Jana. Great to see the demo of the same feature that Kushmika was just speaking to. It's a nice combination. Definitely open to questions, as Gianna said, and we do have one from Willington that Josh had answered. Willington, do you have a sec to come off mute and ask the question? We can have a brief discussion about it with Josh.
Yeah, thank you so much. Yes, my question was, it was very good to see that you can be able to pick the targets that we have within different months and this month, but I was thinking it would have been better if we have those targets again as the performances of either months, either between the same month or the previous month, so that that kind of information can trigger some actions in case you're not tracking well against the targets. I don't know if I'm clear enough.
Yeah, thanks for that. And maybe the short answer is the main goal with this initial feature was to provide something very simple in the UI that was going to kind of address some basic usage right now. Just being able to kind of go back and look at what you had last month. As with lots of new features, sometimes when you're able to do something like that, you realize, hey, it would be great if we could actually have this even better functionality along with it. And so I think that's kind of what's awesome about having this discussion now. We're able to kind of start to brainstorm, how to solve other more complicated needs. The data is all there would be the easiest thing to point out, right? We have stored records of each month's targets values for that user, which is how we're loading last month's. And so I think excuse me, I think we can maybe continue to discuss and refine what kind of comparison workflow might be most useful here. Is it just comparing against last month? Do we want to compare like a trend over time, right? Do we want to compare against an average of the last 6 months, that kind of stuff? I think there's a couple of much more interesting ways we can go past just basic seeing last month. So yeah, I think this is a great conversation to have, and kind of looking forward to where we can take this.
Yeah,
Thanks,
just to add to that, I think we have also had a request from the community where like a trend might be critical for some of the deployments, and some might be thinking of even 6 months or a couple of months just to help supervisors or CHV be able to look at their performance over time.
Thanks, Anthony. And thanks all for the question. Thanks, Wellington. The forum is a great place to dive into this. So, Wellington, if you want to start a thread on the forum, feel free to tag Josh or Anthony or myself. We'll be happy to push along. Oh, Josh, do you have something more?
Just one final preview as we sit here and talk about this too. One of the big efforts we put into on this previous month's targets was actually building the APIs necessary to go back and get the data for those previous month's targets. And those APIs are in place now. Combining that with the UI extension work that is currently in progress, we are very close to kind of people being able to design and easily build a custom view of the targets that they have access to see. And I think that will be very cool opportunity in the future. Even if you have kind of non-standard requirements that may not fit best with other deployments, you could still kind of build what you want or what you need to see.
That's a lovely, lovely point to bring up. So this is an ongoing work that is happening in a squad, similar to how the task filtering and target prior month's targets happened within a squad. There is a squad to be able to add on a plugin for different UI elements. And so those could tap into the APIs that Josh was just talking about. Great conversation here. Thanks so much again for the questions. Any last comments or questions that folks want to bring to the call here before we wrap up? Anthony's added some great links there in the chat about squads and about the work that was done for task filtering. All right, we can go ahead and continue the conversation in the forums. Diana, if you could bring up the last slide there, we can talk about some upcoming events that we have. Oh, wonderful. The slides reminded me that I forgot a very important part. At the top of the 5.1 section, I mentioned that there was 26 contributors, and we did want to go ahead and pull up the list of all the contributors that helped out with the 5.1 release. I'm not going to read them out, but if your name is here, we're really appreciative of your work, and we love to see so many community members here participating and making sure that their specific deployments needs are met. It's the way the CHT can be most effective is when the community is contributing and telling us exactly what their needs are and how we can improve the CHT. I also want to point out that there's a lot more happening beyond the folks that just get sucked up into the GitHub list of folks who have contributed. There are documentation, there's field work, there's interviews, there's so much more that happens beyond the literal coding that we see in the CHT. So I really want to be sure to include the thanks for all the contributors, no matter how small or how big your role was. And with that, oh wait, Timothy, we wanted to tap Timothy's experience for development. Timothy, are you still on the call to give an update on how it went with your contributions?
Yes, hello. Hello, team. Hello, everyone. Yeah, my name is Timothy Jero, developer and cloud engineer here in Nairobi, Kenya. So just to give an overview of my contribution and my journey with working with CHT. So initially, my entry point into the community and into the ecosystem was when I began my work at Health IT. Health IT was a USAID funded organization that was an implementing partner as well in the East Kenya deployment and supporting the trainings and also just rolling out the system in various parts of the country. So I was a part of the team of supporting the user management work stream and also building household registration workflows for the CHWs. And that has also opened a gateway for me just to continue and interacting with the community far beyond my interactions at Health IT. My motivation towards contributing and joining the community is having a sense of belonging. Truly, it has been a wonderful journey, getting to know other partners. I've worked with other implementing partners such as, of course, Medic. I've worked with guys from Living Goods and Luala, and also at the Ministry of Health. I've also worked with other developers and other supporting staff, and it has been a really wonderful journey. And also the systemic approach of how the contributions are done and communications are done on time. And I'm also very grateful for Anthony especially, and Ashley, and I think and Diana, and Josh, just to mention a few, for helping me come to pace and also to onboard and fast track my work stream. Yeah, so I think this has been a commendable work, and releasing the 5.1 is also a proof that the journey is still ongoing, and there are various work streams that I'm still also participating in. I was in the previous month's targets squad, and we were working together with Edwin and Diana and Josh, and those were just people who also guided me through and helped me to deliver the tasks that were assigned to me. Yeah, I'm greatly honored to be part of this journey and looking forward to continue contributing and also supporting the development work stream with CHT and East Kenya at large. Thank you for having me, and back to you, Ashley.
Timothy, thank you so much. It's great to have a voice given to the experience on the squad. If you're interested in how squads work, we have documentation on that. And if you'd like to join any of the ongoing squads, they're open to the public, and we encourage everyone on this call to check out any of them just to listen in how it's going. Or if you're interested in development, go ahead and drop in, or documentation or testing or any of the steps of the way from a code to a feature being delivered like it was in 5.1. So Timothy, thanks again. Great to hear. All right. Next slide, please, Diana. All right, we have some upcoming events that we'd love for folks to attend. The community meetup is coming up on April 14th, and we have the Dev Hour happening on the 26th and on April 2nd. And then next month's Roundup call will be happening on April 9th. We'll be posting a recording and notes on the forum. If you do have any questions, as I mentioned, the forum is the best place to go to participate and ask questions or get help or jump in and help yourself. Please subscribe to the CHT community event calendar, which I just linked to in the chat as well. And thank you everyone very much for showing up. And thank you again to all of our presenters who gave us so much good information about the CHT. Look forward to seeing you. Oh, last minute question from Jeff. Jeff, we have a sec. Do you want to come off mute and give a shout out here about Skull?
Sure. For those who aren't aware, Skull World Forum is a big sort of philanthropy, social innovation week where different sectors get together from agriculture, health, education, etc., to kind of celebrate work, and it's run by the Skull Foundation. So just to shout, if anyone here, if you, members of your team, CEOs, executive directors, or anyone is planning to attend, just let us know. It's a great opportunity to connect and hear more about your work and find some partnership opportunities.
Thanks, Jeff. I think we're going to wrap up the call here, but please do reach out to Jeff directly or post on the forum. Jeff, maybe you want to open up a forum topic on the Skull attendance, see if we can get any takers there.
I can do that.
Awesome. Love it. Okay. Thanks again, everyone. And thanks again to our presenters. We'll look forward to seeing you soon, maybe on April 9th on our next Roundup call. Until next time.